Welcome to the AM News, the very first news bulletin on the Joy News channel. I'm Sweetie Abochi, bringing you details now. 3 radio stations owned by Ashanti Regional NPP Chairman Bernard Enchiboisiakon, popularly known as Chairman Wontumi, have gone off air after the National Communications Authority withdrew their licenses for breaching electronic communications regulations. The NCA says the stations failed to address violations such as the unauthorized use of Studio 2 transmitter link frequencies and unapproved transmitter locations. Officials say an earlier amnesty period was granted for the breaches to be rectified, but the stations did not comply. My colleague Michael Ashali was at Wontumi FM in Accra and reports.
On May 12, 2025, the National Communications Authority announced plans to withdraw the licenses of more than 60 non-compliant radio stations. The move sparked public backlash, prompting President John Dramani Mahama to intervene. The stations were then given 30 days to resolve the infractions. 3 months on, the NCA says the grace period has long expired and the licenses of 6 stations have been revoked. While most affected operators took steps to comply, 3 other stations, all owned by Chairman Wontumi, failed to fully remedy the breaches. Here in Accra, Wontumi 95.9 FM is currently off air. And we can confirm with the radio currently with me. That's exactly what we are getting, static throughout the day. In Kumasi and Takrady, sister stations have also gone off air. The mood in the office is tense and uncertain. Movement TV, operating from Wontumi FM and owned by Chairman Wontumi, continues broadcasting as staff focus on the station, while the parent company fights to overturn the NCA's decision. The Wontumi cluster of radio stations affected by the latest suspension from the NCA have now sent an urgent appeal to the NCA, appealing to it to reconsider its suspension and withdraw that directive. For Joy News, Michael Ashale.
To combat the growing issue of opioid abuse among Ghanaian youth, the Ministry of Youth Development and Empowerment has launched a critical research study on International Youth Day, August 12, 2025, led by Sector Minister George Opariado. Now, the study aims to uncover the root causes and underlying factors driving substance abuse within the youth demographic. We'll tell you more in this report.
Government has taken significant steps to address the growing concern of opioid abuse amongst its youth. On March 28, 2025, a nationwide campaign titled Red Means Stop was launched to raise awareness, prevent and intervene early in opioid addiction cases. As part of ongoing efforts, the Ministry of Youth Development and Empowerment has initiated a comprehensive research study to understand the root causes and extent of substance abuse amongst Ghanaian youth, aligning with International Youth Day celebrations on August 12. Sector Minister George Opariado explains the aim of the research to Joy News.
We have a problem on our hand, but we don't know the gravity of the problem. We don't also know what the main contributing factors are. We know that it's prevalent within young people, but we have different demographics. What we seek to do is to properly understand what the dynamics are, what is contributing to it, and why young people are using it. It is when we have this background, when we are able to understand it this way, then we can sit at the decision table and then look for lasting solutions. A lot of the solutions have been a bit ad hoc, and so we want to go past that, and that is why we've commissioned this report.
After receiving a generous donation of 500,000 Ghana cedis from the RNAQ Foundation to support the initiative, Mr. George Opariado said the donation will significantly enhance the research efforts.
It will go a long way, because the research alone is costing us about 400,000, so we'll expand the scope. He's researching in all 16 regions, but his sample size, we can make him increase the sample size so that we get a more good understanding of what the problems are.
The founder of the RNAQ Foundation, Richard Ni Amakwe, also highlighted that this contribution marks the crucial first step in supporting the Ministry of Youth Development effort to combat substance abuse amongst young people.
I could see from experience how the abuse of opioid and drug abuse is affecting a lot of youth in some African countries, especially Sierra Leone. And I think that our country is also on the path of taking the same trajectory. So today we are here to assure the minister and his team that from the RNAQ Foundation, we understand the threats that we are facing as a nation, and we are solely committed to work hand in hand with you to be able to actually confront these threats head on. And so we have come here to do a presentation of 500,000 Ghana cedis to the ministry today.
The campaign, Red Means Stop, is on, and the research into the causes of the abuse has been commissioned to be unveiled by ending of this month. Mamavi Savakote's report for Joy News.
The diplomatic community in Ghana is pouring in their messages of solidarity as the nation mourns the tragic passing of 8 victims of the helicopter crash that occurred last week. Drawn from various parts of the world, the ambassadors, while signing a book of condolences opened at the Ministry of Foreign Affairs, say they stand with the people of Ghana.
On behalf of me and our President, Excellency Mahmoud Abbas, and our government and all the Palestinian people, I'd like to convey all our condolences to the Ghanaian people. We stand with their families, with the government of Ghana, with the President of Ghana, of course.
And we will mourn, the Russian Federation mourn with Ghanaians on this tragic event that happened on the 6th of August this year in the Ashanti region. And we hope that this tragic events will make the Ghanaian nation stronger.
The spirits of the unity, we are confident that Ghana will go through this phase.
We, the people of Kenya, especially His Excellency President Ruto, the people of Kenya and the government of Kenya, feels deeply the sorrow which the Ghanaian people and the government of Ghana and His Excellency John Dramani Mahama is going through during this tragic moment. These are fallen heroes, people who are on the line of duty, and we feel that these are great loss for Ghana.
So I brought forward the condolence on behalf of the Czech government and the Czech nation. Our collaboration with Ghana, of course, is very long-standing, and we mourn with Ghana in this very difficult moment.
No, but I just expressed my sorrow, my grief, and my sincere condolences to everyone who knew the victims of this tragic incident and accident.
Amid recurring water shortages in Akotochiri and its environs, the Iowa-based Project of Hope Foundation has delivered a lifeline, donating a borehole and water tank to Our Lady of Assumption Catholic Church, bringing renewed hope of safe drinking water to residents in the area and surrounding communities who are deprived of this basic necessity. In an interview, Father Francis Valentin Odum said the foundation's goodwill is inspired by biblical principles, noting that its mission for the past 5 years is to provide safe drinking water to communities without access.
Through its Wells for Ghana project, the Project of Hope Foundation donated a borehole and a reservoir tank to the Our Lady of Assumption Catholic Church located in Akotochiri, Cape Coast. Speaking in an interview, the priest in charge of the church, Father Francis Valentine Odum shared his hopes of the donation not just serving the Akototri community, but its surrounding areas as well.
In this community, we have, thankfully, we have access to water from Ghana Water Company. But as we know in Ghana, perennial water shortages, and also we still have those households that do not have access to Ghana Water Company. So people assess other wells that we feel are not as portable and clean as possible. So Projects of Hope Water in Akototri will obviously be help and health giving to this community around us.
One of the sponsors of the donation, a professor at the St. Ambrose University in Davenport, Iowa, Dr. Monica Forrest, commended the efforts of the foundation.
I cannot say how proud I am that and impressed that Project of Hope Ghana has built over 50 wells to provide villages with clean water. It's just amazing. I think it is a miracle, and it's the hard work through this Project of Hope team. And I know that there are a lot of supporters in Iowa. Back home, Father Francis was the priest for so many different churches there, and they all love him and are so happy to be able to support this effort, so to provide for the health and well-being of communities.
The church president of the Our Lady of Assumption Catholic Church, Faustina Owusu-Ansah, shared some words of gratitude.
I'm very excited about what we are doing today. I would like to thank Reverend Father Valentine Odum, because through him that this project came to our aid. Project of Hope, I will thank them too, because through them we have gotten clean water. And it's not purposely serving only the church members, but also serving the community. We are much grateful to the Project of Hope.
From Akototri in Cape Coast, Abigail Lisol in Kuma reports for Joy News.
Now, the distributed IoT platforms, privacy and edge intelligence research, that is DEPA Lab at the Kwame Nkrumah University of Science and Technology, has held a stakeholder engagement session with healthcare workers, including general practitioners, pediatricians, nurses, lab technologists, among others. The engagement was organized to present and receive feedback on several low-cost medical innovations developed by the lab to improve neonatal care and reduce infant mortality in Ghana. Speaking at the event, Reverend Dr. Prince Odame, Child Health and Innovation Team Lead at DEPA Lab, explained the rationale behind the initiative. There's more in this report.
The lab showcased a range of medical devices and tools focused on neonatal health, including affordable phototherapy units for treating jaundice, automated exchange transfusion devices, an AI-based jaundice detection system, color-coded thermometers, sleep apnea monitoring devices, and low-cost incubators. Speaking at the event, Reverend Dr. Prince Odame, Child Health and Innovation Team Lead at DEPA Lab, explained the rationale behind the initiative.
We decided to have the stakeholder engagement because we cannot sit in the lab, conceptualize the problem, come up with a solution, and then after I've gotten the solution, we're happy ourselves that we have a solution. What we actually want to do is to have real life impact. We want the solutions that we come up with to be adopted in medical circles and actually end up saving lives at the hospitals. So we decided to bring the major players, in the health industry here today, to engage them, to show them what we have, to have them make input into what we have, to alert us on the ones that will work and the ones that will not work, so that at the end of the day, these devices can be adopted by them and be used in our hospitals to save lives.
Despite some progress, Ghana continues to record a high number of newborn deaths due to preventable causes such as jaundice, respiratory distress, and hypothermia. Experts have emphasized the need for homegrown, low-cost interventions that can be used in resource-constrained settings. Dr. Adoma Odame is the Deputy Team Lead of the DEPA Lab, Child Health and Innovation Team.
as a pediatrician working in child health, seeing newborns die, we realize that it's very important for us to, as much as possible, develop interventions, low-cost interventions, easily usable within our environment that can save lives of newborns. So that's one of the reasons why I'm on board with this whole concept of development of devices and AI tools that will help reduce mortality of our newborns and our children in general. Because the mortality rates for Ghana, even though they have come down, they are not where we want. And even every single death is a death which is too much. So that's why we are in this, trying to build devices.
The engagement drew participation from pediatricians across the country, many of whom expressed strong support for the lab's approach. Dr. Eugene Mate, the Ashanti Regional Chair of the Pediatric Society of Ghana, was impressed by the lab's innovations and highlighted the importance of the devices.
One common condition that actually brings a lot of children to the ICU and contributes a lot to mortality is pneumonias and respiratory failure. So I was really excited to hear our biomedical engineers thinking of innovative ways and affordable ways to make sure we have adequate supply of CPAP machines. That is one of the important or key non-invasive respiratory support that we can have for our children. So I'm really excited and I look forward to more innovation from DEPA Lab.
The stakeholder meeting marks a significant step in bridging the gap between biomedical research and frontline healthcare delivery in Ghana, with a shared goal of reducing preventable deaths among newborns.
I'm handing you over to Samuel Kojo-Brace, who is excited to bring you business update now.
Well, let's start the business update with an industry I so love. Now, the Chamber of Agribusiness Ghana is asking government to be strategic about its quest to cut the import bill of palm oil by $2 billion by the end of the year. According to the Chamber, although the policy is feasible, government must be deliberate about innovative data research to achieve the set target. Anthony Morrison is the Chief Executive of the Chamber of Agribusiness Ghana.
We also need to be looking at what are the various innovations we can bring on board. We need to look at the researchers. We need to look at the dynamics. Because, for instance, when you go to Malaysia, Malaysia is having huge challenges with the palm production, okay, as a result of environmental issues and challenges with food security and other areas of affecting. But, palm in itself is also a huge industrial commodity, at the same time a domestic commodity. So we need to balance the two. What, for us, is our technical advantage? Are we looking at the export market? Are we looking at the industries? And we are looking at also feeding the domestic market. So quite clearly, palm is a major factor in several of the things that we do, both at the manufacturing level, which is industry, even at pharmaceutical level. There are some biscuits and lipsticks that we use palm to do, and a lot of people do not know about that. Even in the aviation sector, we use palm to do a lot of things. And also, when it comes to our household chops, everybody like the copper. We like our favorite green with the red on it. So it's quite clearly, and also palm has become a West Africa thing.
Now, away from that, the Deloitte Ghana has cautioned government against its plan to return to the capital markets due to improved macroeconomic environment and the resultant upgrades by the international credit rating agencies. The following report captures more.
According to the professional services firm, the government must take recycling lessons from historical mistakes to avoid a repeat of the debt hangover experienced over the last 3 years. Deloitte Ghana gave the caution following the 2025 mid-year review budget. It added that reliance on foreign debt must be moderated, with inflows strictly channeled into strategic capital investment that can adequately support repayment of such loans. As of the end of June 2025, Ghana's total public debt had reduced by $113.7 1.7 billion Ghana cedis, representing 15.6% reduction from 726.7 billion Ghana cedis as at the end of December 2024 to 613 billion Ghana cedis in June 2025. This was mainly on the account of the appreciation of the Ghana cedi.
Well, let's conclude the business update with what's happening on the commodities market. That's all in our business update for you today. There's more on myjournal.com/business. Coming up next is sports here on the AM Show.